You're young, you're active, and maybe your cholesterol is just a little bit high, and so it gets shrugged off. Or you're young and you live in a larger body and get quickly told, just lose weight. In both cases, with little consideration of the fact that you've been diagnosed with PCOS. So if you have PCOS, that little number might be your heart's early warning system. So let's talk about what most people miss, why, and also what we can do about it. I'm Dr. Melanie Deschatelet, a naturopathic doctor licensed in British Columbia, Canada. I have my prescription authority, I have lab access, and obviously a real deep passion for natural therapeutics and lifestyle support. Since 2010, I've been practicing. That's over 15 years. And at this point, I've literally worked with thousands of people, and I've always had a special focus on PCOS. I also teach about PCOS at the clinician level. So just last year, I spoke exactly on this topic, PCOS and heart health, to a room full of doctors. So I promise you though, this video is going to be funner. So stick around. And I also like to educate to the public, people interested in PCOS worldwide. And so I'm also the founder of the PCOS Shift Society. It is a membership, and I would just so love to see you inside. So quick note before we go deeper, this isn't medical advice, and I'm not your naturopathic doctor. It's the educational version with some popcorn, so binge responsibly, take notes, and loop in your own healthcare team. If I am your naturopathic doctor, then take notes and let's loop that up at your next visit. Okay, cool? Let's go. So PCOS changes how your body produces, transports, and clears cholesterol. So just think about a complicated transport system in your body, and people with PCOS often have some changes in that transport system in cholesterol. And so what we'll see is there are more people with PCOS that are going to have higher cholesterol than people of the same age and size that don't have PCOS. But two, if we look at ratios and at a deeper look at cholesterol, people with PCOS tends to have the type of cholesterol that is more atherogenic, which means likes to slip under the endothelial cells, meaning like in the blood vessels, and create those plaques. And so these shifts can occur even when body weight is considered healthy and even when diet is fairly on point. We know that this is kind of complicated, that there's some genetic components to that, and also some hormonal drivers like testosterone and insulin resistance. So the metaphor is that we have delivery trucks that are broken or poorly routed, and that just sets us up for delivery system that is less favorable. Okay, point number 2. Lifetime exposure matters more than just one test. A single cholesterol test is a snapshot, not the full story. It's like taking a photo. And the catch is when we're looking at older people who are getting cholesterol at an older age, that snapshot, if we put it through a calculator, can give us a pretty good idea of risk. But this calculator is not very accurate for people who've had high cholesterol from a young age or who have genetic factors that drives cholesterol. What we're learning in the research now is that the cumulative exposure over decades actually contributes a lot to risk, which makes a lot of sense. If somebody's had high cholesterol since their 20s versus the person who developed high cholesterol in their 60s, who's going to have higher risk over their lifetime? And so even someone who's had high cholesterol since their 20s and 30s and wait until their 60s to treat it more aggressively, they will still have higher risk than someone who started earlier. So in people with PCOS, in people who are already on the higher end of things at an earlier stage, it's the length of the movie that matters. So if you start early, your movie is going to be really long. There's way more opportunity for poor cardiovascular health. And this is so much more accurate than a snapshot. And point number 3 is that the PCOS guidelines recommends early testing. The International PCOS guideline recommends that everyone at diagnosis gets a full lipid panel. And this is something I see missed a little bit more regularly, because often people that are getting diagnosed are young and they're not usually on the radar for getting their lipids screened. And sometimes we forget that the PCOS diagnosis is a reason to do it. And this applies to all bodies. The guidelines are clear. We don't care your body size, we don't care your age, and we don't care your symptoms. When you get diagnosed, we need to know where you're at. Now, what do we do after that to track? That's a bit more of a nuanced conversation with your healthcare provider. If the original screenings were really, really low risk, then maybe it's not checked that frequently. But if we see right out of the gates that cholesterol is kind of on the higher end, then you're already on a path of better monitoring and better support, both lifestyle, but also what interventions can be added onto that as well. So ask your provider if you've had a full cholesterol panel, if you've been properly diagnosed with PCOS. And if you haven't, then I highly recommend that you do, just so you know where things are at. Point number 4, we know that people with PCOS are more likely to have higher cholesterol and might be flagged sooner and earlier. But there is still this separate genetic condition called familial hypercholesterolemia. And it's a genetic condition that causes high cholesterol from birth. And it's important that this gets screened for if you've had a high cholesterol reading. Because if we just blame PCOS for your high cholesterol and we don't actually look to see if it's this more even greater intensive version of cholesterol, the risks associated with that are even differently and even higher for people with familial hypercholesterolemia. So if you've had your cholesterol panel tested and you want to kind of check in and know if this is a conversation that you should have with your healthcare provider, if you are ages 40 and up and you've had an LDL, so we're looking specifically at the LDL part of the cholesterol panel, greater than 5.0 millimole per liter or 193 milligrams per deciliter, that is considered a threshold worth screening for. If you're greater than 4.5 millimoles per liter or 174 milligrams per deciliter and your age is 18 to 39, that's an LDL threshold worth screening for. Or if you're under 18 and you have an LDL of greater than 4 millimoles per liter or 155 milligrams per deciliter, that also is a value that means that you should be screened for. Again, I'm not saying that it's diagnostic. It's absolutely not diagnostic. It just means that if you have LDL levels in those categories above that, it's a conversation that you should loop in with your family, with your healthcare provider to look into it. Also have a higher degree of suspicion if you've had a lot of other first degree relatives with high LDL or really early heart disease in the family, meaning men below the age of 55 having heart attacks and things like that, or women before the age of 65. So have a conversation with your doc and see where your cholesterol panel is there, and just make sure that it doesn't deserve that extra level of screening for familial hypercholesterolemia, because that is kind of like an added wild card, okay, to the deck. Lastly, point 5, you can change the story, okay? And this is the good news, is I know sometimes when we talk about this, it might for some people feel a little bit overwhelming, like, wow, there's already annoying symptoms I'm dealing with PCOS. Now I have to worry about my heart, and something that's not even bothering me right now. But the good news is the evidence-backed nutrition patterns are also good for blood sugar balance, are also good for inflammation. And so you're going to see things kind of just all diverge in the same direction. So there's positive research for heart health with the Mediterranean diet, with the portfolio diet. When we focus on having adequate amount of fiber in our diet, when we are doing movement that fits your life and aiming for 150 to 300 minutes a week, when we are focusing on sleep quality. So the good news is the solutions are kind of piling onto a similar theme. That is the good news. But the education piece is to have awareness, because it shouldn't be shrugged off. And I think information can be powerful. If you know that this is something that is higher early on in your life, you really have such a powerful position to treat this with lifestyle and also potentially also nutrient related things as well as medication to really lower your risk and totally change that risk trajectory. And that's why information is power, is because if you do something about it earlier, that impact over decades is humongous. So PCOS isn't just about hormones, and your heart is part of that story. Everyone who's been diagnosed with PCOS should have a full lipid panel at diagnosis. That is based on the PCOS guidelines. Know your family history for cholesterol or early heart disease. If you've had lipid panel, just look at those thresholds for screening for familial hypercholesterolemia. And if you meet them, then just loop your healthcare provider back in. It's not diagnostic. It doesn't mean you have it. It just means that we should check. Okay, so just remember, small steps now means huge compounding difference later. So now I really want to welcome you into the PCOS Shift Society. You already know that having a diet that was higher in vegetables and more protein and fiber was probably a good thing. But often the disconnect is in the doing. And so this is a membership that is focusing on PCOS IQ, accountability, and a really sweet community to help you get there. So if you want to get my free PCOS lab guide, it is available in the community. Just join and you'll get access to that. If this video has helped you, please share it with someone else you know that has PCOS, because this impacts 10% of people. So odds are you know someone else. Okay, thank you so much for being here and have a great day.